Michael Hayes and I'm a respiratory physician. About half my practice is sleep. I do sleep apnea a lot, and then the other half is lungs, which is emphysema, asthma, lung cancer. I spend a lot of time diagnosing cancers and working out what's wrong with people, getting them treated. So I do diagnosis. I'm a physician, and then some treatment.
I'm Jo Hayes and I'm a GP. It used to involve seeing patients that came in, but now with COVID, a lot of it's on the telephone. So I go into my room and ring people and talk to them on the phone, and they explain their rash or something that's not easy to diagnose over the telephone. I much prefer having somebody there to talk to in person and communicate with, yeah.
So when it arrived, my practice kind of almost went off a cliff, really. We were thinking, we're going to be really busy, and for the first few months we were really quiet because we had to shut down our sleep lab, we had to shut down our lung function lab, we couldn't do the tests that we normally do. And the other thing that happened was that people were really scared of going anywhere near doctors or medical centres or hospitals, so if they could possibly stay away, they did. So a lot of people stayed away. So it's a bit paradoxical. I'm a respiratory physician, and in the middle of a pandemic, we're closing down the office, putting off staff and shutting days. Now that's all picked up again now and it's all settled down, but the initial experience of COVID was exactly the opposite of what you might think. We were kind of sitting around twiddling our thumbs.
So it was a bit like that in the surgery too. People weren't coming in, but
Yeah.
now they're coming in with a list of all the things that they haven't dealt with the last 6 months. You can do telephone consultations and we can be reimbursed for it. Not good medicine, to try and talk to someone on the phone and describe their symptoms of a cough, or you can't listen to the chest, you can't look at a skin rash, you can't, you have people sending photos of a red eye that they think something's in, but that's not something you can deal with on the telephone. Once it became obvious that we had it under control in Australia, it's not as scary. Yeah. And also we've kind of
always do
a little bit resigned, what will be, so we're always going to be first hit in a pandemic, so if we get it, we get it. So
I've treated TB, and for years, and respiratory physicians have more TB because they're in the firing line, so it kind of goes with the territory, really. If you're looking after people with infections, then you're at risk. When I was training, there was another trainee with me, a cardiothoracic surgical trainee. We had a fair bit to do with each other. He was a young surgeon, I think, by the time it happened. He operated on an infectious case, caught the infection. It was, and he was dead 12 hours later. It is kind of something we're always aware of, and this pandemic maybe made it a bit more out in the public consciousness, but we're always kind of aware of that.
I cycle to work every day, or the days that I work. I swim in the mornings. I do something every day, so either a walk. During COVID, there was the beach was a highway. There was lots of people walking, so we'd just join the social distance, but walk. Yeah, so walk, swim, ride.
I got right into running, and and running was perfect in the pandemic because it wasn't affected by the pandemic at all, and I discovered running and how much I love running. I was fitter than I have been for a long time, and loving it. So the pandemic was probably good for exercise. So I did an Ironman last year, so I was doing lots of swimming and cycling then. I concentrated more on my running this year, so this year more running, but I swim every Friday, like this morning, yoga, and then riding. stay positive.
Yeah, so
Yeah.
just look after yourself basically,
Yeah.
which means eat well, get enough rest, get enough exercise. Yeah.
Yeah, I think
I
that's
guess.
right. If you're going to be looking after other people, you've got to be okay yourself. So you got to. And for me, that means getting enough exercise. It's really simple. I get enough exercise, I'm happy. I don't get enough exercise, I'm not.